So let's start the class. In today's class, we will be covering the module 6. In module 6, majorly we will be talking about the skin tumors and some other conditions. Okay, so let's start. This is just an overview. We will be discussing about the premalignant lesions, basal cell carcinoma, squamous cell carcinoma, and melanoma. Okay, in melanoma, there is a very important classification and a table which you need to know. Now, if I talk about skin, then the total weight of the skin is around 16% of the total body weight. Surface area is around 2 and thickness is around 0.5 to 4. The layers that you have is your epidermis, then you have a basement membrane, then you have a dermis, and then you have a subcutaneous layer. So this is the diagram which you are able to see. Above we have the epidermis, then we have a dermis, and below the dermis we have a hypodermis. Okay. Now, next, epidermis has a thickness of around 0.07 to 12. In the benign tumors, you mainly have seborrheic keratosis. Then you have the melanocytic nevi. Then you have the dermatofibroma, keratoacanthoma, pilar cyst, epidermal cyst, skin tags, syringioma, and other conditions. We will study and discuss about each and every condition in details. So, number one that you have is seborrheic keratosis. So it is one of the most common benign tumors of the skin, and it is unusual before the age of 30. So whenever the patient will come to you and they will present you with this condition, there are likely chances that the age of the patient is above 30 and not below it, because below 30, this condition is very, very rare. Now, most people develop at least one seborrheic keratosis in their lifetime.
Not every dark spot is harmless. Some pigmented lesions may be the earliest sign of melanoma. To identify melanoma early, remember the ABCDE rule. A stands for asymmetry. One half doesn't match the other. B stands for border irregularity. C stands for color variation within the lesion. D stands for diameter greater than 6 millimeters. And E stands for evolution, any noticeable change over time. Early diagnosis can significantly improve melanoma outcomes. Advance your dermatology expertise with Medical Global Academy.
Swelling that arises from the skin, what you have benign papilloma, then you have sebaceous cyst, then you have strawberry nevus, this is the strawberry nevus, then you have the histiocytoma. Premalignant lesions, you have leukoplakia, you have actinic keratosis, you have radiation keratosis, star keratosis, you have arsenical keratosis, Bowen's disease, and you have the erythroplakia, followed by a Paget's disease. So coming on to the leukoplakia. So the etiology is mainly due to smoking, syphilis, sepsis, and the sharp edge of the tooth. Incidents, they mainly occur in 40 to 70 people who are in between the age of 40 to 70 years, they are likely to develop the leukoplakia, finding that we are able to see in this patient. Now, arsenical keratosis, this is the clinical finding. You don't need to go into the details. Tar keratosis, so etiology is mainly due to the exposure to polycyclic aromatic hyperhydrocarbons. Okay. Bowen's disease, it's very, very important. It is also called as the carcinoma in situ and squamous intraepidermoid neoplasia. Etiology mainly involves predominantly the skin unexposed to the sun. So, incidence involves the genital regions of both men and women above the age of 35 years. If I talk about the histopathology, so you have a gross feature and a histological feature. So gross feature, there will be solitary, thickened, gray-white, opaque plaque with swollen ulceration and crusting you will be able to see. In histology, there the epidermis mainly show a proliferation with numerous mitosis and some of them are atypical. See this grossly that you are able to see. This is the
Not every pigmented lesion is harmless. Bowen disease is an early form of squamous cell carcinoma in situ. It commonly appears as a slow-growing red scaly patch. Chronic sun exposure and aging are major risk factors. Dermoscopy plays an important role in clinical evaluation. A biopsy is essential for definitive diagnosis. Treatment options include excision, cryotherapy, and topical therapies. If untreated, it may progress to invasive carcinoma. Early recognition significantly improves patient outcomes. Master advanced dermatology concepts with Medical Global Academy.